Hi there, my name is Dr. Mark McRae, and I am a board-certified plastic surgeon with a practice that specializes in facial plastic surgery and breast plastic surgery. Today we're going to speak to you about how to prevent reoperation with breast implants. We mentioned in another video that the FDA has put on each breast implant box a black box warning, and a part of that black box warning is that breast implants are not lifetime devices. And so if you're signing up for a breast augmentation or breast reconstruction, there will be an additional surgery in your future beyond the initial surgery that we perform, and that could be either to replace or remove those implants. But here's a slide that discusses the main causes of reoperation, and there are others that aren't listed here. However, the first one I'd say is implant integrity is one of them. And breast implant manufacturers generally say the rupture rate it's certainly less than this, but they would say up to 1% per year, but that is a reason why it would require to be reoperated. The second is capsular contracture, and this is an overreaction of scar tissue in the body around the implants in the breast that can cause pain and appearance to change, and it can be a visible deformity. The third is implant movement. This implant movement could be something as simple as when you flex the pectoralis major muscles, the implant moves in position. This is called the animation deformity. This wasn't really a big issue before it was kind of popularized more and is now called an animation deformity. Patients kind of just understood that if the breast implants were placed under the muscle, that there would be this movement. And so, but nowadays with other techniques, this can be corrected. And so that's another reason for implant revision or reoperation. The fourth is malposition of the implant. And what causes the implant to move over time? Well, we still haven't found a cure for gravity or time. And so gravity is continually acting on the breasts. And so the breasts move down over time. The implants can as well. They can move though in all other dimensions too. And so we'll talk about how to avoid that or to reduce it as much as possible. And finally, infection. So I think there are lots of things that can be done to prevent infection. Again, infection rates are never zero, but there are a bunch of things that can be done to address this. So just getting right to it. In terms of implant integrity, what's our game plan for that? So really surveillance of implants. If you have a silicone-based implant, the plan is generally speaking to get some form of imaging, usually at the 6 to 8 year mark, whether that be a breast ultrasound or an MRI of the breasts implants to assess their integrity. And then the Food and Drug Administration in the United States recommends every 2 to 3 years after that to have some form of imaging. In Canada, we don't have that formal recommendation, but I think it's a decent practice. 2, capsular contracture. So to help prevent the formation of excessive scar tissue around the breast implant, there are several things now that can be done before surgery, at the time of surgery, and after surgery. We now understand that one of the potential causes and a likely cause of capsular contracture is actually bacteria. And these aren't bad bacteria that are causing infections, but these are bacteria, there's one called Rosternella. And it's an indolent, meaning it's not very active, but it's a bacteria that might get on that implant somehow, and it causes an inflammatory reaction of some kind over time and causes this scarring issue. How can we prevent this? Well, one is a no-touch technique for the implant. That means that when we take the breast implant from the Ziploc, the air tight packaging, we actually put it directly into something called a Keller funnel, and we put it directly into the pocket that has been meticulously dissected, and then placed and it's never touched. So no touch technique really decreases the likelihood of any kind of bacterial contamination of any kind. We also use washes now, antibiotic washes that are placed into the pocket and around the skin of the breast before the breast implant is placed. We also prevent contamination. So what does that mean? Well, actually, one very important way to prevent contamination during surgery is to select a location to make that breast pocket which has the least chance of any bacteria. A decision to have an incision in the axilla or in the armpit is one that can be made for the appearance of the scar. However, that is a very dirty location, and even with antibacterial scrubs, there's very thick glands in that area, and so contamination is a higher risk in that location. Also, if approaching the breast from around the areola, so an incision within the areola, which also hides very nicely. Unfortunately, to get the implant in that location often disrupts some of the ducts of the breast, and those ducts contain bacteria. They're not harmful bacteria generally, but anything that touches that implant will cause an increased risk for capsular contracture. And so really the best location to eliminate or decrease this risk is just in the fold of the breast underneath. And so by placing in that location, the breast parenchyma actually doesn't even get violated. And so it can be placed under the muscle fascia, the so-called subfascial location, above the muscles, so we don't get this animation issue, which we'll talk about in a minute, but away from all the breast parenchyma. And so there's no risk of those kind of bacterial contamination that may increase your likelihood of a capsular contracture. There's other things during surgery we do, like covering the nipple areolas with a occlusive dressing, so again there's no cross-contamination. And in my practice, we also have an enhanced recovery after surgery protocol, which I'll speak about when we speak about infection. Okay, so I think we already talked about implant movement, placing the implant, if possible, above the muscle. My preferred location is below it's called the fascia that invests the muscle, and placing it under that, and that allows me to keep that implant away from the breast parenchyma completely, but it's a location that you don't get that movement when there's firing of the muscles. Implant malposition, I think the biggest and most important thing to prevent this is to choose the right size implant. And I'm a very conservative surgeon, so I think in general going too large is a problem. And the reason why it's a problem is that the breast has very important support structures to it. There are ligaments that connect the skin to the chest wall, and there are very important ones that are located around the periphery of the chest wall. If you choose an implant that is too wide or too large, it'll either divide those ligaments completely or really impact the integrity of them. And so the implant will move potentially in all kinds of directions because those natural barriers that kind of maintain the integrity of the breast location have been violated. And so that's why in your consultation we'll recommend a certain size range based on your anatomy, based on your chest wall, that is going to be safe. And that's to really help prevent that implant malposition that can occur. There are factors, there are certain patients that have certain integrities of their tissues, that say massive weight loss patients that have lost a lot of weight. Sometimes those tissues aren't quite as strong, and so implant malposition is a much higher risk, and we'll discuss that in your consultation as well. The last one is infection. So I think the infection can be reduced, and we do several things in terms of enhanced recovery after surgery protocols. Things like body washes before surgery, having certain carbohydrate rich drinks before surgery, no pets allowed in the bedroom or in your bed after surgery, no smoking whatsoever before or after surgery. These are all things that can really minimize the infection rates, and that we can also discuss in your consultation. So thanks again for your attention and time. And more in this series in terms of breast implants, what you need to know. Thank you.